In this video, we will be covering angina. Angina is a type of chest pain caused by reduced blood flow to the heart. Angina is a symptom of coronary artery disease. Angina also is called angina pectoris. Angina can be described as squeezing pain in the chest, feel like some pressure in the chest. There can be a heaviness feeling in the chest. It can be tightness or pain in the chest. It may feel like a heavy weight lying on the chest. Angina pectoris is a clinical syndrome usually characterized by episodes of pain or pressure in the anterior chest. It is caused by insufficient coronary blood flow resulting in a decreased oxygen supply when there is increased myocardial demand for oxygen in response to physical exertion or emotional stress. In other words, the need for oxygen exceeds the supply. Angina is a chest pain resulting from myocardial ischemia caused by inadequate myocardial blood and oxygen supply. Angina is caused by an imbalance between oxygen supply and demand. Demand is more but supply is less. Now we will see what causes angina. Blood carries oxygen, which the heart muscle needs to survive. When the heart muscle isn't getting enough oxygen, it causes a condition called ischemia. The causes include the heart arteries called the coronary arteries can become narrowed by fatty deposits called plaques. This condition is also called atherosclerosis. This causes obstruction of coronary artery blood flow. The most common cause of reduced blood flow to the heart muscle is coronary artery disease, or it can be due to coronary artery spasm. Plaques in a blood vessel may rupture or cause a blood clot. These events can quickly block or reduce the blood flow through a narrowed artery. This can suddenly or severely decrease blood flow to the heart muscle. Increasing myocardial oxygen consumption while exertion can cause angina. The heart muscles may still be able to work during times of low oxygen demand without triggering angina symptoms. For example, is when resting, but when the demand goes up, such as exercising, angina can result. Poor blood flow through a narrowed heart valve can also reduce the blood flow to the heart that can cause angina. Who is at risk of angina pectoris? Anything that causes the heart muscle to need more blood or oxygen can result in angina, especially if already have a blockage or narrowing. Risk factors include increased age. Angina is most common in adults aged 60 and older. It can be because of family history of heart diseases. Tobacco use. Smoking, chewing tobacco, and long-term exposure to second-hand smoke, that is passive smoking, can damage the lining of the arteries. Artery damage can help cholesterol to deposits and block blood flow. Diabetic mellitus. Diabetic increases the risk of coronary artery disease. Coronary artery disease can cause angina. High blood pressure. Over time, high blood pressure damages arteries by speeding up the hardening of the arteries. High cholesterol or triglycerides. Too much bad cholesterol, called low-density lipoprotein (LDL), in the blood can cause arteries to narrow. A high LDL level increases the risk of angina and heart attack. A high level of triglyceride in the blood also is unhealthy. Other health conditions like chronic kidney disease, peripheral artery disease, metabolic syndrome, or a history of stroke increases the risk of angina. An inactive lifestyle raises the risk of high cholesterol, high BP, type 2 diabetic, and obesity. Obesity is a risk factor for heart disease, which can cause angina. Being overweight makes the heart work harder to supply blood to the body. Emotional stress. Too much stress and anger can raise blood pressure. Rushes of hormones made by the body during stress can narrow the arteries and worsen angina. Medicines. Some medicines tighten blood vessels, for example, certain migraine medicines. Drug misuse, cocaine, and other stimulants can cause blood vessel spasm and trigger angina. Cold temperature. Exposure to cold temperature can trigger some types of angina. Now we will see the pathophysiology of angina. Angina is usually caused by atherosclerotic disease. Almost invariably, angina is associated with a significant obstruction of at least one major coronary arteries. Normally, myocardium extracts a large amount of oxygen from the coronary circulation to meet its continuous demands. When demand increases, flow through the coronary artery needs to be increases. But when there is a blockage in a coronary artery, flow cannot be increased and ischemia results. Several factors are associated with typical anginal pain. Physical exertion, which precipitates an attack by increasing oxygen demand. Exposure to cold, which causes vasoconstriction and elevated blood pressure with increased oxygen demand. Eating a heavy meal, which increases the blood flow to the mesenteric area for digestion, thereby reducing the blood supply available to the heart muscle. In a severely compromised heart, shunting of blood for digestion can be sufficient to induce anginal pain. Stress or any emotion provoking situation causing the release of catecholamines, for example adrenaline, noradrenaline, dopamine, which increases blood pressure, heart rate and myocardial workload. Unstable angina is not closely associated with these listed factors. It may occur at rest. Now we will see the types of angina. There are different types of angina. The type depends on the cause and whether rest or medicine eases symptoms. First one is stable angina. It is also called exertional angina. It is predictable and consistent pain that occurs with activities that involve exertion or emotional stress. It is relieved with rest or nitroglycerin. Usually has a stable pattern of onset, duration, severity, and relieving factors. Stable angina is the most common form of angina. Pain that starts when we are walking uphill or in the cold weather may be angina. Stable angina is predictable. It is usually similar to previous episodes of chest pain. The chest pain typically lasts for a short time, perhaps 5 minutes or less. Next is unstable angina. It is also called pre-infarction angina or crescendo angina. It is associated with worsening cardiac ischemia, occurs with an unpredictable degree of exertion or emotion and increase in occurrence, duration and severity over time. Symptoms increase in frequency and severity. Pain may not be relieved with rest or nitroglycerin. Unstable angina is unpredictable and occurs at rest, or the pain is worsening and occurs with less physical effort. Unstable angina is typically severe and lasts longer than stable angina, maybe 15 minutes or longer. If the blood flow doesn't improve, the heart doesn't get enough oxygen, a heart attack occurs. Unstable angina is dangerous and needs emergency treatment. Next is variant angina. It is also called Prince metals or vasospastic angina or variant angina pectoris. It is a rare condition. This type of angina is due to coronary artery disease. It is caused by a spasm in the heart's arteries. The spasm temporarily reduces blood flow. Severe chest pain is the main symptom of variant angina. It almost often occurs in cycles, typically at rest and overnight. The pain may be relieved by angina medicine. It occurs almost only at rest, not after exercise or stress. It is also more common in women. Attacks may be associated with ST segment elevation noted on the ECG. ECG elevation can be reversible. It may be triggered by smoking and increased levels of some substances, for example, histamine, epinephrine, and cocaine. Treatment may include long-acting nitrates and or calcium channel blockades. Exposure to cold temperature can trigger Prince metals angina. Next is intractable or refractory angina. Intractable angina is a chronic, incapacitating angina unresponsive to interventions. Angina episodes are frequent despite of combination of medicines and lifestyle changes. Next is silent ischemia. Objective evidence of ischemia such as electrocardiographic changes with a stress test, but patient reports no pain. Patient may not complain chest pain, but we may observe ischemia on ECG. Next is microvascular angina. This used to be called syndrome X. It causes chest pain with no coronary artery blockage. The pain is caused from poor function of tiny blood vessels that lead to the heart, arms, and legs. It is more common in women. It may be triggered by activities of daily living, for example, shopping and daily work. The treatment may include nitroglycerin in long and short-acting forms. What are the symptoms of angina? Angina symptoms include chest pain and discomfort. The chest pain or discomfort may feel like burning crushing, squeezing pain. The patient may feel like pressure and fullness in the chest. Pain can be substantial. Pain can develop slowly or quickly. Pain usually is described as mild or moderate. Pain may radiate to the shoulders, arms, jaw, neck, or back. Pain intensity is unaffected by inspiration and expiration. Pain usually lasts less than 5 minutes but may last 15 to 20 minutes. Pain is relieved by nitroglycerin or rest. Other symptoms of angina include shortness of breath, that is dyspnea, weakness. The patient may have extreme tiredness, feeling faint, dizziness, and syncope. The patient may have nausea, sweating, palpitations, and tachycardia. The patient may have hypertension. Some patients may have digestive disturbances. Patient may look pale because of lack of blood supply. The severity, duration, and type of angina can vary. New or different symptoms may signal unstable angina or a heart attack. Any new or worsening angina symptoms need to be checked immediately by a healthcare professional. The healthcare team can determine whether it is stable or unstable angina. Symptoms of angina in women can be different from the classic angina symptoms. These differences may lead to delays in seeking treatment. For example, chest pain may not be the only symptom or the most common symptom. Other symptoms of angina in women may include discomfort in the neck, jaw, teeth, or back, nausea, shortness of breath, stabbing pain instead of chest pressure. Stomach pain, angina chest pain is usually relieved within a few minutes by resting or by taking prescribed cardiac medicine such as nitroglycerin. How to differentiate between angina and myocardial infarction or heart attack? Angina can develop slowly or quickly, usually prescribed as mild or moderate pain. It can be substantial, crushing, squeezing pain, may radiate to the shoulders, arms, jaw, neck, and back. Angina usually lasts less than 5 minutes, however, can last up to 15 to 20 minutes. It is relieved by nitroglycerin or rest. Myocardial infarction occurs without any cause, primarily early in the morning. Patient will have crushing substantial pain. It may radiate to the jaw, back, and left arm. It lasts 30 minutes or longer. It is unrelieved by rest or nitroglycerin and relieved only by opioids. How is angina pectoris diagnosed? Healthcare provider will ask about medical history. They will do physical exam. A healthcare provider can often diagnose angina from symptoms and how and when they occur, and may also have tests such as electrocardiogram. This test records the electrical activity of the heart. It shows abnormal rhythms, that is arrhythmias, and it detects heart muscle damage. Next is stress test. This is done while a person exercises on a treadmill or pedal a stationary bike. The test checks the heart's ability to function when under stress such as exercise. Breathing and blood pressure rates are also watched. A stress test may be used to find coronary artery disease, or it may be done to find safe levels of exercise after a heart attack or heart surgery. A type of stress test uses medicine to stimulate the heart as if a person was exercising. An exercise treadmill test only uses an ECG to evaluate for ischemia. A stress echocardiogram uses an ECG and ultrasound picture of the heart. A nuclear perfusion stress test uses an ECG and a radioactive tracer detected by a nuclear camera. Next is cardiac catheterization. A wire is passed into the coronary arteries. Then a contrast dye is injected into the artery. X-ray images are taken to see the narrowing, blockage, and other problems of certain arteries. Next is cardiac MRI. This test can look at the amount of blood flow to the heart muscle. Coronary CT scan. This test looks at the amount of calcium and plaque inside the blood vessel of the heart. It can also show blood flow through the coronary arteries. And chest X-ray may be taken. Troponin and cardiac enzyme levels are normal in angina. How is angina pectoris treated? Treatment will depend on symptoms, age, and general health. It will also depend on how severe the condition is. Interventions include immediate management, assess pain, institute pain relief measures, administer oxygen by nasal cannula as prescribed, assess vital signs, and provide continuous cardiac monitoring. Healthcare provider may prescribe medicines if a person has angina. The most common is nitroglycerin. Nitroglycerin is prescribed to dilate the coronary arteries. This lets more blood flow to the heart muscle and reduce the oxygen requirements of the myocardium and relieve the chest pain. It decreases the workload of the heart. Client may take a long-acting form of nitroglycerin daily to prevent angina, or client may take it as a nose spray or under the tongue when angina occurs. Ensure that bed rest is maintained. Place the client in semi-forward position and stay with the client. Obtain a 12-lead ECG. Establish an IV access route. Don't give erectile dysfunction medicines if client is taking nitroglycerin. These include sildenafil, vardenafil, and tadalafil. This can cause a dangerous drop in blood pressure that can lead to death. Tell healthcare provider if client is taking ED medicines. Other medicines can be used to treat angina. These include beta blockers. It blocks a hormone that increases the heart rate and blood pressure. This helps relax the blood vessels to improve blood flow. Calcium channel blockers to dilate coronary arteries and reduce vasospasm. Nitrates to dilate the coronary arteries and decrease preload and afterload. Cholesterol-lowering medications to reduce the development of atherosclerotic plaques. Antiplatelet therapy may be prescribed to inhibit platelet aggregation and reduce the risk of developing an acute MI. If the patient is diabetic management to be done. Next is surgical treatment. Surgical procedures such as percutaneous transluminal coronary angioplasty is a minimally invasive procedure that opens blocked coronary arteries to improve blood flow to the heart muscle. PTCA helps to compress the plaque against the walls of the artery and dilate the vessel. Laser angioplasty, also known as excimer laser angioplasty, is a medical treatment used to remove blockage or narrowing of the arteries to reduce the risk of heart problems such as heart attacks. It involves inserting a laser-emitting catheter into the narrowed part of the artery, and when the laser is turned on, the plaque is vaporized, reducing the block. Laser angioplasty is to vaporize the plaque. Atherectomy is a way of removing plaque, a fatty substance that narrows the arteries and reduces blood flow to the heart and other organs. Vascular stent to prevent the artery from closing and to prevent restenosis. Coronary artery bypass grafting. A coronary artery bypass graft involves taking a blood vessel from another part of the body, usually from the chest, leg or arm, and attaching it to the coronary artery above and below the narrower area or blockage. This new blood vessel is known as graft. The number of grafts needed will depend on how severe the coronary heart disease is and how many of the coronary blood vessels are narrowed. A coronary artery bypass graft is carried out under general anesthetic. It usually takes between 3 and 6 hours. What are possible complications of angina pectoris? Angina means that some part of the heart is not getting enough blood. The chest pain that occurs with angina can make doing some activities such as walking uncomfortable. However, the most dangerous complication of angina is a heart attack. Prevention of angina. Angina is prevented by following the lifestyle changes. Keeping up a healthy lifestyle can help to delay or prevent angina pectoris. A healthy lifestyle includes eat a healthy diet, physical activity, that is exercise regularly, reduce stress by stress management, should not smoke, keep a healthy weight, taking medicine as prescribed, treating high blood pressure, high cholesterol, diabetes, and excess weight. Avoid or limit alcohol. Manage other health conditions related to heart disease. Get 7 to 9 hours of sleep a day. If anyone have angina, note the patterns of symptoms. Pay attention to what causes the chest pain, not what it feels like, how long the pain lasts, and if medicine relieves the pain. Call emergency if angina symptoms change suddenly. This is called unstable angina. It's important to work with the healthcare provider to treat coronary artery disease which causes angina. Need to control the risk factors. These include high blood pressure, cigarette smoking, high blood cholesterol levels, lack of exercise, excess weight, and a diet high in saturated fat. Take medicines exactly as directed. This is an important part of living with angina. If the client is taking nitroglycerin, make sure to have it with at all times. Take it as instructed whenever angina occurs.